Today we are going to talk about an extremely important topic related with the cardiology, that is that during one cardiac cycle, what changes occur in the blood volume in the left ventricle and pressure changes in the left ventricle. And here is a graph which represents those changes, right? This graph is representing changes in the left ventricle volume and pressure during one cardiac cycle. And let me explain this graph, right, step by step. Let's suppose we start from here, from this point. At this point, what is the condition of the heart? Let's suppose exactly at this point, right? At this point, left ventricle has already pumped the blood and now relaxing. And when left ventricle is relaxing, we say that it is going into diastole. And when pressure in the left ventricle, when it is relaxing, goes down, aortic valve closes, right? But still pressure here is more than the pressure in the atrium. So mitral valve is not yet open at this point, right? What is happening? That aortic valve, left ventricle is relaxing, aortic valve has already been closed, and mitral valve has not yet opened. But during this, there will be some blood present in the left ventricle. That will be the residual blood which is left in the ventricle from the previous contraction, from previous systole. So what we can say that at this very moment, right, there is some blood which is already present in left ventricle, and this blood is actually left in the left ventricle after the previous ejection of the blood, right? And this blood is present in the left ventricle at the end of the previous systole. So we call this volume of the blood end systolic volume. What we call it? End systolic volume. End systolic volume. So first of all, we should understand what is end systolic volume. While we are drawing this graph, on x-axis we are showing the volume, on y-axis we are showing the pressure, right? And we see here that at this point the volume is about 50 ml, right? Volume is 50 ml. It means this 50 ml of the blood which is present in the left ventricle while left ventricle is undergoing relaxation, right? This is called end systolic volume because it is present in the cavity of the left ventricle at the end of the last ejection phase, right? Or at the end of previous systole. Now, there is a very important event which occurs here. And why this event occurs here? Actually, as left ventricle keep on relaxing, pressure in the ventricle keep on dropping. You see here, as left ventricle is relaxing, pressure is dropping. This is pressure. It is dropping. And eventually, pressure in the left ventricle will drop so much that it will be less than pressure in the atrium. Already we know that atria is a low pressure chamber, right? But before, what happens? Before I explain what happens then, let me explain that during the previous systole, mitral valve was closed and from the lungs, pulmonary circulation was sending blood to atrium, left atrium, right? When previously it was contracting, right? In the previous cycle when it was contracting, mitral valve was closed. During that time, the blood which was coming from the pulmonary circulation through the pulmonary veins. You should know that there are 4 pulmonary veins, and this blood is coming and accumulating here, and that is accumulating in the left atrium. It is accumulating into left atrium. This blood which is accumulating, this blood is called, at this stage we can say that left atrium is acting as a reservoir. Again, I will explain it. During the previous systole, when left ventricle was contracting, mitral valve was closed, and whatever blood was returning from the pulmonary circulation via the pulmonary veins to the left atrium, this blood was accumulating in left atrium, and left atrium was behaving as a collection reservoir, right? Or it was behaving as a tank. It was collecting the blood. Now we come back to this story that when it is relaxing, pressure was dropping. A time will come that pressure in the, what is this? Left ventricle will become less than left atrium. Let's suppose that pressure in the left atrium is, we are just supposing that pressure in the left atrium is 7 millimeter of mercury. 7 millimeter of mercury. As soon as pressure here becomes 6 millimeter of mercury, then mitral valve will automatically open. And the moment mitral valve will open, this accumulated blood will rapidly fall into ventricle. Right? Again, ventricle started relaxing, intraventricular pressure rapidly dropped, and eventually pressure in the ventricle become less than the pressure in atrium. At that very moment, when pressure below the mitral valve is less and above the mitral valve is greater, then what happens? Then mitral valve opens. And the moment mitral valve opens, right, this blood which was accumulated during the previous systole, this will very rapidly enter into left ventricle. And we say there is rapid filling phase. There is rapid filling phase. Now, this is the moment when mitral valve opened. This is the moment, I will put it here a star. The star one event is, mitral valve opening. The moment mitral valve will open, which heart sound will be heard? Remember, no, listen, if cardiac valves are healthy, their opening should not produce any sound, right? Please write it down. Opening of healthy cardiac valves do not produce any sound, they open silently. So I must say mitral valve which opened here, right? Here mitral valve which opened, it opened silently. There is no sound here. But accumulated blood from previous cycle from the atrium rapidly enter into ventricle, right? And now here you look at the volume parameter, that volume from 50 ml rapidly increase, right? And this rapid filling, this is called rapid filling phase. Okay, this is rapid filling phase, right? 50 ml was already there, which was from previous systole, and systolic volume was already there. Now to this, what has been added? More blood. And what is this blood? I will make a diagram here, that we can make a diagram to show this stage, that mitral valve is open and aortic valve is closed, and this was end systolic volume. Now there is rapid filling of left ventricle from the previously accumulated blood in the atrium. This is rapid filling phase. So I will write it here, rapid filling phase. This is rapid filling phase. Now here I want to highlight one thing. With this I will explain all the cardiac cycle and relationship between the graph and different events at different points of the graph. So first event was here, that mitral valve open, right? And before and rapidly blood is filling into ventricle. Now when there is rapid ventricular filling, sometimes even in healthy hearts, it produces significant turbulence to generate a sound which is called S3. It means sometimes, not always. Yes, this is sound of rapid ventricular filling. Remember, in most of the people, the sound is not heard, right? But in young children, in pregnant women, or during the exercise, just after the exercise, or athletic persons, where rapid ventricular filling is more than normal rapid, right? If due to any reason, if there's too much blood coming here, right, blood movement might become so turbulent that it may produce a sound, right? How it will produce sound? There will be turbulence in the blood flow that will vibrate the ventricular chamber. Then of course, eventually it will be picked up by the chest wall. If it is in the left ventricle, it must be picked up from apex beat. And because it is relatively soft sound, right, so it must be best heard with the bell, right, not with the diaphragm. With the bell at apex beat, patient left decubitus. At the end of expiration, you might hear S3 in people, sometimes normal like children or pregnant women, because she has a hemodynamic circulation and rapid flow. So rapid in flow become more rapid in flow, or in athletes, right, in such conditions, right? So we can say that in exercise, in children, young adult, or pregnant women. So presence of S3 is not necessarily pathological, right? But there are conditions, pathological conditions, in which S3 can also be heard. Those pathological conditions in which rapid ventricular filling phase is accentuated. For example, if someone has mitral valve regurgitation, right? Or someone has some other cause of hyperdynamic situation like severe anemia, right? Or hyperdynamic condition like hyperdynamic circulation like thyrotoxicosis. So in those conditions, when blood is rapidly entering, right, during the rapid filling phase, more than normal rapidity will produce a sound that is S3. So S3 can be normal and it can be pathological. But if someone asks you, what is this, at what time S3 can be heard? S3 is heard almost at the end of the rapid ventricular filling phase, and it is a feature of rapid flow. Now, this blood has gone down. If this blood has gone down, this accumulated blood during the rapid ventricular filling phase, this has gone into ventricle. We can say that this blood has been added here. Now this was the blood which was accumulated in the it was accumulated into ventricle or pushed into ventricle during rapid filling phase. Now ventricle is more filled, and I will say this is rapid ventricular filling. Now our graph has moved from opening of the mitral valve, which was silent opening, to the rapid ventricular filling phase. At the end of the rapid ventricular filling phase, you might hear S3, right? Now actually accumulated blood from the atria has already entered here. After that, what will happen? After that, whatever blood is coming from pulmonary circulation, it will just pass through atrium as if atrium is a pipe. After this event, once the rapid ventricular filling phase is over, right? Now atria, whatever blood it is receiving, it is directly just passing through the atrium and falling into ventricle. This is slow filling phase. This is slow filling phase. Previously, because accumulated blood was there, so that was rapid filling phase. But after that, this is slow filling phase. And this slow filling phase, I can show here as up to this. This is slow filling phase, right? Slow filling phase. Important thing to remember is the difference in first rapid ventricular filling and slow ventricular filling. The important difference in these two is this was accumulated blood and it starts as soon as mitral valve open, and once all accumulated blood has already gone to the ventricle, then pulmonary venous blood which is returning to the left atrium will directly just pass through the atrium, using the atrium as a conduit or as a pipe, and fall into ventricle. That is slow ventricular filling phase. But in both cases, there is no atrial contraction. I did not say that here there was any atrial contraction. Even in this case, there was no atrial contraction. So both these filling phases are not active because atria is not actively contracting. So we will say this is, both events are passive. So we can say passive rapid ventricular filling. This was passive rapid ventricular filling. And after that, this was rapid. This was very important. And here, the more blood which has come, right, this blood was also coming passively, but relatively slowly. This is slow ventricular filling phase, or we also call it diastasis. Diastasis, right? So we can draw here diastasis, that in this case, what is happening in diastasis? Yes, aortic valve is still closed, mitral valve is still open. As blood is coming, it is directly adding to the ventricle. This stage is diastasis. Usually, this is the longest phase of left ventricular filling. And during tachycardia, when tachycardia occurs, heart rate goes more, total cardiac cycle time reduces. Now, cardiac cycle is having two main phases, systolic phase and diastolic phase. So, during tachycardia, diastolic phase reduces more than systolic phase, right? And in diastolic phase, this is the slow ventricular filling which reduces more rapidly, right? For example, I will give an example that if your heart rate is 72 beats per minute, then what happens? That 60 seconds divided by 72 is equal to 0.8 second per cycle. So 0.8 second, let's suppose I draw here systole, it is 0.3 second, and diastole, which is in this case suppose it is 0.5 second. But if heart rate is become double, okay, we make it 120. Heart rate we make 120 beats per minute. This is tachycardia. Now 60 divided by 120 and it will become 0.5. Now this was the time for total cardiac cycle, which should include systole and diastole. So in this person, maybe diastole will be reduced less and it is 0.3, it is 0.25, right? Diastole and reduced, sorry, systole reduced, but diastole is shortened more. How much it is? It is also become, let's suppose, 0.25. So you see there's significant drop in diastolic time and slight drop in systolic time. And in this time, the maximum reduction is in diastasis phase, in this part of the graph, right? After that, left atrium will contract, and when left atrium will contract, after that left atrium will contract and it will give final push to more blood, right? That is the last filling phase. And because at this phase atrium is contracting, we call it active phase, or we call it atrial push, or we call it last filling is by atrial systole, or by the atrial contraction, or by the atrial kick, or by the atrial push. This blood which comes due to contraction of atria, right? This is last 20% filling of the left ventricle, right? It makes about last 20% filling, and this is called active atrial filling phase, right? Here I can draw, this is here atria contracted. So this diagram was here and I can draw one diagram more here, that at this moment atria is contracting. And as you remember, just for a little revision, before opening of the mitral valve, which blood was here? And systolic blood. Then rapid ventricular filling, don't forget S3. Then slow ventricular filling or diastasis, right? And don't forget, in tachycardia this phase reduces, and then last filling when atria contract, and this last filling is active filling. This is also called atrial kick. Normally this blood, when atria contract, that last 20% of the blood which is pushed to the ventricle, this blood is not required in a healthy heart during routine cardiac output. For example, if you are not doing any exercise, it means to produce normal cardiac output, even if atria do not work, right? The filling which was rapid ventricular filling and slow ventricular filling, both of them make about 70 to 80% of the filling. That is enough for a person to produce enough cardiac output during rest. But if you go for exercise or physical exertion, then you really need extra blood coming from the atrium, right? Now this 20% which is added by the atria, we call it active active ventricular filling. Active contraction by the atrium, but filling of the ventricle, right? So first two fillings were passive, passive rapid filling, passive slow filling, then active filling by the atrial contraction or atrial kick. Here I want to remind you one thing. Usually in healthy person, when atria contract and push the last 20% of the blood, in most of the healthy person, it does not produce any sound. It does not produce any sound. Remember, S3 is rapid passive ventricular filling. It can produce in healthy children, healthy young adult, or in pregnant healthy women, or even in, yes? Athletes, right? But S3 can be produced normally as well as abnormally. So S3 can be physiological or can be pathological. But almost always, if sound is produced by the atrial kick, this is abnormal. This sound is called S4. This is called S4. S4 sound is here, just before the next ventricular contraction. By the very end of diastole, by the very end of ventricular filling phase. Now, I told you, almost always it is abnormal. Rarely in very elderly persons, it may be heard and considered normal. Now, when S4 is produced, as I told you, most of the conditions it is not, most of the situations, in normal conditions it is not produced. S4 is produced when atria is strongly contracting against a stiff ventricle. In many diseases, for example, in left ventricular hypertrophy, left ventricle become stiffened, and during diastole, it does not relax well. We say there is diastolic dysfunction, right? If during diastole, left ventricle fail to relax completely and thoroughly, we say there is diastolic dysfunction. So when there is left ventricular diastolic dysfunction, or when left ventricle is stiff, or it has reduced compliance, reduced stretchability, then atria will be pushing the blood to a stiffened ventricle, and during this, because atria has to contract more than normal, this blood will go faster than normal, and that will produce sound, and that sound is called S4. So what does it mean? It means S3 is produced by passive rapid filling. When you have rapid inflow of blood or when you have a dilated heart, S3 can be there. But S4 can be there when there is hypertrophied atrium and especially straining against stiffened ventricle, right? So, we have seen our first part of the pressure volume loop. Now here we have seen that as there was rapid ventricular filling, then there was slow passive ventricular filling, and then active filling. But there is no significant change on the y-axis. There is no significant change. There is a little change, but no significant elevation of intraventricular pressure. Why? Because ventricle is not contracting. Because ventricle is just relaxing, right? So because more and more blood is coming, and it is, if it is compliant left ventricle, normal left ventricle, it will keep on relaxing and dilating and accommodating the blood, right? And if it's keep on accommodating the blood, then pressure will not significantly go up, right? But let's suppose there is hypertrophied heart. Left ventricle is hypertrophied, right? This is hypertrophied left ventricle. In this case, what will happen? That when blood will, end systolic blood will be there, then rapid passive ventricular filling, then slow filling, which is diastasis, and then strong atrial kick. Now, in this condition, because it is not relaxing well, so as it is filling, pressure will go up, right? You can see that rather than it's almost straight line, it will start going upward. Is that right? So, if ventricles become less compliant, less accommodative, more stiff, right, don't relax properly, then even during the filling phase, pressure in the ventricle starts going up more than normal, right? Not too high, but still more than normal. We have shown here end diastolic pressure volume relationship, that at the end of the diastole, at the end of the filling phase, if ventricle was stiff, then pressure will go up. But if ventricle is pliable, pressure will not significantly go up. Is that right? This graph I will discuss in next lecture in detail, this part of the graph. Let's go with the normal. Now, once all these filling is done, right, during this, there's a time now that ventricular systole should start. What should start? Ventricular systole. So as soon as ventricular ventricle has been filled, now ventricle is going to contract. Previously ventricle was relaxed to open the mitral valve and receive the blood. Now it is properly filled, diastole is complete, filling phase is complete. Now ventricle is going to contract. Now, the moment ventricle start contracting, immediately mitral valve will close. Why? Because pressure in atria is not very high. So the moment ventricle start contracting, a little pressure in ventricle goes up. It will push the mitral valve leaflets, right? As soon as ventricular systole occur, blood push the leaflets of mitral valve, and mitral valve will close. So now what we can say? Now there is a unique situation. Ventricle has been filled, and now ventricular systole started, ventricle start contracting, and the moment it start contracting, right, the pressure in the ventricle intraventricular becomes more than intra-atrial, and mitral valve is closed. I will use the right word. Mitral valve is shut close, because when ventricular systole occur, pressure will very rapidly start going up, and these leaflets, mitral leaflets, which were dangling like this, when ventricle will contract, they will very rapidly come and hit each other, and that will produce a sound which is called S1. So S1 sound is basically sound generated by the closure of mitral valve in the left ventricle, and of course tricuspid valve on the right side. When AV valve, atrioventricular valve, or mitral valve and tricuspid valve at the onset of ventricular systole, when they close, they produce vibrations. And those vibrations, not only valve leaflets vibrate, even blood column vibrates, and that whole vibration produces S1 sounds. Again, which is in mitral component is best heard at apex speed. Is that right? So, what was the event here? Here was the onset of ventricular systole. How we know there is onset of ventricular systole? Because here the pressure start going up. If suddenly pressure rapidly is going up in the ventricle, it means there's onset of ventricular systole. And here, this movement, I can put it star 2. Star 2 movement is, star 2 is mitral valve closure, and that produces S1. Right? So mitral valve will close over here and S1 will be produced. Right? Now, there's a very unique situation. For example, pressure here was 8 millimeter of mercury. The moment pressure here was 9 millimeter of mercury, these valves were closed. But pressure in the systemic circulation, especially in the root of aorta, is about 80 millimeter of mercury. Now, left ventricle has an issue. It has started the systole. As soon as systole start, pressure in the ventricle become more than pressure in the atrium, closes the mitral valve, but if pressure is 9, 10 or 20 or 30 or 40 millimeter of mercury, it is yet not enough to open the aortic valve. Now is the situation that backflow channel is closed and forward flow is yet not open. When systole is there, ventricle is contracting, rapidly increasing its intracavity pressure. And at the beginning of this event, it closed the mitral valve because atria had very low pressure. So, intraventricular pressure rapidly become more than intra-atrial pressure. But because aortic pressure is very high, so now ventricle keep on contracting. And how long it will contract? It will keep on contracting and squeezing itself until pressure rises in the cavity above the pressure in the root of aorta. Only then aortic valve will open. So until this phase is there, that mitral valve is closed, inflow valve is closed, outflow valve is still not open, inflow valve is closed. Listen, left ventricle is contracting, now inflow valve is closed and outflow valve is not yet open. So what is happening now? Left ventricle is contracting as a closed chamber. It is contracting as a closed chamber, right? And there is no change in the volume of the blood because no blood is entering and no blood is leaving. So we say this is isovolumic phase, or some books write isovolumic. That is perfectly okay because volume of blood in the ventricular cavity does not change as nothing is entering and nothing is leaving. Some people call it isovolumetric contraction. Isovolumetric contraction means that there's no change in volume and there's no change in the size of the ventricle. But by the way, there's a little change in this squeezing ventricle shape. Ventricular shape slightly changed, but I will not go into that detail. So ventricle is now squeezing the intracavity blood and pressure is rapidly going up. You see at the y-axis. Pressure is rapidly going up, but there is no change on the x-axis. It means there is no change in the blood volume. No blood is added, no blood is removed. So blood volume remains the same. Let's suppose it is 120 here or 130 ml, but pressure rapidly goes up until the pressure in ventricle becomes more than what? Pressure in the root of aorta. And only then aortic valve will open. And only then blood will be able to eject itself from the ventricular cavity to the arterial system. Right? Now this phase, When ventricle started contracting, mitral valve was closed, contraction continues, and still aortic valve is not open, we say ventricle is contracting as a closed chamber, right? Or we call it isovolumetric contraction phase, right? From star 2 until star 3. Star 3 is the point where it will open. In between that is rapid intraventricular pressure elevation, where ventricle is contracting as a closed chamber. This phase is called isovolumic contraction.